Hi everyone, welcome you all to Dr. Rohini's Sthree channel dedicated to women's health. In my last video, I had given you all the information about how much of weight gain in pregnancy is appropriate and how much is too much. And today, let us try to get more information about the weight gain in pregnancy. How much we have to gain in the first trimester, second trimester, and the third trimester. So, in the first trimester, actually there is no need or no problem if even if she doesn't gain weight in the first 3 months of pregnancy, because in the first 3 months of pregnancy there is no increase in the weight of the baby. The only the all the organs and the whole body of the baby is forming in the first 3 months of pregnancy, and also there will be a lot of nausea and vomiting for the pregnant mother in the first 3 months. So she and also she cannot even eat well in the first 3 months. So it's okay even if she doesn't gain any weight during the first 3 months of pregnancy, or it's okay even if she gains up to 1 to 2 kilos. And in the second trimester and the third trimester, that is in the fourth month of pregnancy, um, the she can increase the requirement, the amount of food she takes. Along with the regular amount of food which she eats, she has to just add another 300 calories for her dietary intake. There is no need to eat too much also. This much is enough, especially for a pregnant lady who is underweight and normal weight. She can increase her dietary intake by another 300 calories. And to monitor whether her pregnancy weight gain is appropriate or not, the simple tip which I can give is, for an underweight woman and a normal woman, if she gains around 400 to 450 grams of weight per week, it is considered as normal. Whereas for a overweight and obese woman, it is enough if she gains around 150 to 200 grams of weight per week, and there is no need for her to increase her intake too much like a underweight or a normal weight woman. It's enough if she increases her calories by around 100 to 150 calories per day in her second trimester and the third trimester. And also we should know when the amount of weight gain is inappropriate and when it is less or when it is more. Per week, if she is gaining less than 200 grams of weight per week, then it is considered as abnormal. And if she is gaining more than 650 to 680 grams of weight per week, then it is considered as abnormal. So there are some reasons for that. Especially if she is not able to gain weight, the most important reason will be the excessive nausea and vomiting of pregnancy. Then she will not be able to eat well. So that is the most common reason why she is not gaining weight. Or there can be a reason that the baby may not be growing well inside. So but if the ultrasound says the baby weight and growth, everything is fine, then there is no need to worry much about it. And what could be the reasons for excessive weight gain during pregnancy means, sometimes there is excessive collection of extravascular fluid in her body, fluid retention. Especially if a woman has hypertension in pregnancy, there is a lot of fluid collection, fluid retention in her body. Or in some cases the mother may have heart disease or heart failure, and sometimes there may be kidney problems. So all this can be the reason for excessive weight gain. I mean, when you see a mother, you can understand that her face is blown up, edematous, her legs are swollen, her hands are swollen, sometimes the abdominal wall are swollen. This is considered as an abnormal weight gain in pregnancy. Apart from these reasons, another common reason why she can give excessive weight gain in pregnancy is overeating. So in our culture, it is common that once a woman becomes pregnant, everybody starts telling that you have to eat for two, you have another person inside your body, you should consume more, you have to eat more, which is actually not a good idea. Because if she eats too much, whatever excess she is eating apart from the calories which I mentioned to you now, if she is eating too more than that, that extra calories will go and get deposited as fat stores in her body, and it is not going to improve the nutrition of the baby. So that is the reason there is no need to eat excessively during pregnancy. So what are the problems which can happen when the weight gain is excess in pregnancy, or it is not up to the mark in pregnancy. When the weight gain is excess, it can cause problems to the baby and the mother both. So what happens to the baby is, when the weight gain of the mother is too much, that contributes to the excessive weight gain of the baby. So the baby will be large for date, and after delivery that excessive weight gain can continue, and it can lead to childhood obesity also. When it comes to the mother, this excessive weight gain in pregnancy can cause problems for her during delivery, and it can increase the rate of cesarean section rate. It can increase the incidences of hypertension in pregnancy. It can increase the chances of diabetes in pregnancy. So all these are the problems which can have during pregnancy. And what happens after delivery? Even after delivery, it might become difficult for her to lose her weight. I have seen very less women who have successfully lost their uh, pregnancy weight after delivery. I mean, it needs lot of determination, and very less women will become successful in shedding those extra few kilos which they have gained during pregnancy. So what happens then? The next pregnancy she will gain more weight, the next pregnancy she will gain more weight, and once she becomes obese, this obesity continues lifelong, and it can have the other adverse effects, like it can increase the chances of diabetes, hypertension, arthritis, and cardiac diseases, and so on. So these are all the problems which can be modified or controlled by being little conscious or cautious about the weight gain during pregnancy. uh, Also, it is not good if a pregnant woman is not gaining the recommended weight in pregnancy, because if the weight gain in a pregnancy is less, especially in an underweight woman, if she doesn't gain the good amount of weight in pregnancy, that can even affect the baby, that can make the baby small for gestation, and even after delivery that can cause problems for the growth of the baby. And even for the mother, there may be like chance of having preterm birth, that is the baby may deliver even before the expected a few weeks before her delivery. So all these problems also can happen if the mother is undernourished and if she doesn't gain enough weight during pregnancy. So the key word is a balance. So it's not good to gain excess weight also, and it is not good not to gain weight also. Always there should be a balance, and this should be the principle of our life also. Having a balance in everything is the key factor. So I think this much of information is enough for today. Take care. Namaste. If you like these videos, please like, comment and share. And for more updates on women's health, please subscribe to my channel and don't forget to press the notification bell.